So we start with the portal vein, which may look a little intimidating, but it's not. One is here, which would be our left hepatic vein. And then there's another major branch that goes to the right lobe of the liver called the right hepatic vein. And then here is the hepatic portal vein itself. Now, if you wanted to, you could just call it portal vein, and that's okay. That portal vein is going to give us our next branches. So let's go ahead and pull up the splenic. And with the splenic vein, where do you think you would say it goes? It would go to the spleen. The continuation of the portal vein that continues like this is going to be our superior mesenteric vein. Hanging off our splenic vein, we're going to find the inferior mesenteric vein. So let's add those on. Not good enough, obviously. So again, these veins will travel exactly with the rest of them. So they start from a different place. They're not coming from the abdominal aorta, obviously. So they come from a different area, but this inferior phrenic vein is going to join up with the inferior phrenic artery as it passes through that mesocolon to get to our digestive arteries. The superior mesenteric vein, it actually is very close, like from the beginning, right with the superior mesenteric artery. So it's pretty easy to identify. So let me clear my drawings off there. So I'm not going to add in all those other branches, but I do want to show you this from this point of view, just so that you understand, like, structurally what this is. Now, the portal vein is draining all of our abdominal viscera, and it's going to go up to our liver, essentially to detoxify it. One thing that's important to understand about this portal system is that it doesn't have any valves. So whenever I take a step and my muscles squeeze together, what do they do to all that venous supply? Pumps. But when my muscle relaxes, what happens to the blood? Does it go all the way back to my feet? It gets caught on a valve. Okay? Those valves prevent the black flow of blood. So if we have no valves in this portal system, what does that mean for the patient who maybe has cirrhosis of the liver and the blood vessels are actually constricted? Is it possible that we're going to see that blood flow actually go back this way where it came from? And we'll start seeing the distension of all those blood vessels. So with someone who has severe hypertension or portal hypertension, if you raise their shirt up and you actually look at their tummy, you'll actually see lots of veins, like really swollen, like a bodybuilder's big veins or something like that, all over their stomach. We call that caput medusa, after Medusa with snake hair, right? And that's kind of what it looks like. If someone has heart failure, remember at the back of the liver, what big vessel is behind the liver? The inferior vena cava. That goes into the heart. So if there's something that's occluding the heart, like let's say we had some sort of tricuspid valve stenosis, and blood couldn't get through the valve the way it's supposed to, that blood's just going to back up down into the liver, which is going to affect all the blood flow that's coming from the viscera, which again could lead to portal hypertension. So again, cardiovascular disease could cause it, lung disease could cause it, because if there's a resistance to the fluid getting to the lungs, it's going to back up into the heart, then the liver, and then into the viscera. Yes, ma'am?
Can you clarify the difference between the portal vein and the hepatic portal vein?
There's really not. I mean, technically, if we wanted to, we could say before it enters the liver, it would be the portal vein.
Okay.
And as it enters there, we call it the hepatic portal vein.
Okay.
But really, it's all part of the portal system. So if you were to call it hepatic portal vein, cool. If you were to call it portal vein, that's cool. I'll take it. Sometimes you'll look at different atlases and it will call the exact same thing the portal vein, and then you'll look at another one, it calls the exact same location the hepatic portal vein. So we're not going to worry too much about it. So again, that portal system is draining everything, it's detoxifying all the stuff that's coming through our abdomen. But again, it is susceptible to lots of pressure changes or issues with pressure flow. Any questions about that portal system?